why I chose to be a colon rectal surgeon. I can remember growing up as a young child having my own issues, but as I got older and as I became a medical student, I learned more and more about my family's history and that my grandmother and her sister both had colon cancer. And so I would hear from my father about every time he had a colonoscopy, and I thought that was interesting. So that kind of pointed me in that direction. I'd like to think that I have a very good impact on the patients that I treat and their families, of course. I think that having cancer is life-changing type of diagnosis, and it really affects the patient's whole being, and it really affects the family dynamics. And I hope that through my interventions that I could help them along that journey and point them in the right direction, and at some point heal them, cure them. I think my work with cancer patients over the past several years has really enriched my life, has changed me in a positive way. I take bits and pieces of everybody's story and internalize them, and I think it makes me a better doctor. I think it really humanizes a person, and it keeps me grounded. What I do for a living absolutely makes me appreciate life and the fragility of life. Not every outcome that we have is a positive outcome, and what inspires me is to keep honing my skills, to keep improving myself so that we can have better outcomes as I meet patients in the future. I'm really just the tip of the iceberg when it comes to a patient's interaction with the medical system. There's so many people beyond the doctor. I'm only one cog in the wheel of what happens for these patients.